Hi, everyone. I'm Dr. Peter Salerno. I'm a doctor of psychology. I'm a retired licensed psychotherapist and a personality disorder specialist. I'm also the author of The Nature and Nurture of Narcissism and Traumatic Cognitive Dissonance. And before I begin, I want to be clear. This video is educational only. It's grounded in peer-reviewed research and diagnostic criteria, not my personal opinion. Everything that I present can be verified in the references that I provide, which will be in the description section of this video. Throughout the process of earning my doctorate and after earning my doctorate, I dedicated my continuing education to two specialties: abuse and trauma and personality disorder pathology. So as you go through this video, I ask you kindly not to blame the messenger. This is no different than discussing research on heart disease or cancer. So the topic of this video is personality disorders in relationships, and I'm going to talk about the 4 cluster B personality disorders: antisocial personality disorder, narcissistic personality disorder, histrionic personality disorder, and borderline personality disorder. Let's start with a foundation. Personality refers to the enduring aspects of inner mental life, our characteristic ways of thinking, feeling, perceiving, believing, and behaving. Personalities are stable over time, while moods and behaviors may shift day to day. Personality traits show relative consistency. Here's an example. Imagine an introvert. One day they might feel down, fatigued, or irritable. The next day they may feel energetic and productive. Later, they could fall ill and become short-tempered, leading to conflict with their loved ones. But those are symptoms or temporary states. They come and go. But underneath it all, the person is still an introvert. They didn't morph into a narcissist, a manipulator, or a combative personality. The trait is introversion, and it remains stable despite daily fluctuations. A personality disorder, on the other hand, is defined as an enduring pattern of inner experience and behavior that deviates significantly from cultural expectations. It is pervasive and inflexible, begins early in life, is stable across time, and causes significant interpersonal distress and impairment. This is why it's essential to distinguish traits from symptoms. Symptoms ebb and flow. Traits are ingrained and consistent. It's very important to remember that traits remain stable even when moods fluctuate. To use another example, a narcissist may appear vulnerable or depressed after being passed over for a promotion. In that moment, they may seem down, anxious, but beneath that temporary state, the core traits remain unchanged: grandiosity, lack of empathy, a need for admiration. Those traits don't vanish just because the person feels down in the dumps. Patterns in a personality disorder are maladaptive and inflexible, leading to problems in relationships, work, and other areas of personal life. Unlike situational symptoms, personality traits don't reset once stress passes. For example, during a breakup or when preparing for an important exam, someone may feel anxious, lose sleep, and become more suspicious of others. But when the stress resolves, their trust and their outlook return to normal. That's an example of situational anxiety. Now compare this to someone with paranoid personality traits. Even when life is calm, they remain mistrustful, rigid, and quick to assume malicious intent. The suspicion is not episodic or symptomatic. It's part of their enduring personality. This is the difference between symptoms that ebb and flow and traits that persist across time and contexts. The DSM-5 gives us 2 frameworks for diagnosing and understanding personality disorders. First, we have the traditional categorical model. Diagnosis is essentially checklist-based. Meet a set number of criteria, and the diagnosis applies. As an example, in borderline personality disorder, any 5 of 9 criteria qualify. This creates heterogeneity. There are 126 ways someone can qualify, so 2 people with BPD may look very different in presentation and expression. Then we have the dimensional model, which is the DSM-5 TR alternative model, sometimes referred to as the trait model. Instead of checklists, the model measures the severity of impairment and frequency of maladaptive traits. The DSM-5 recognizes 5 broad domains and 25 specific trait facets. Traits are more stable than symptoms. Again, symptoms wax and wane, traits endure. Both models are valuable. The categorical model offers clarity, while the dimensional model captures nuance and severity. Together, they explain why identifying these disorders in real life can be quite challenging. So we're going to start with antisocial personality disorder. Antisocial personality disorder is characterized by social irresponsibility, disregard for others, deceitfulness, and manipulation of others for personal gain. In relationships, antisocial personality disorder is experienced as callous exploitation. They coerce others into romance or sex without any concern for harm, and they are prone to violence and aggression even when they aren't provoked. Relationships are short-term, transactional, and devoid of commitment. Lies, fraud, and manipulation are routine. There is no remorse or love. Partners are seen as opportunities, not people. From a dimensional perspective, antisocial personality disorder reflects enduring antagonism, disinhibition, and callousness, traits that remain consistent across situations and relationships. Next, we have narcissistic personality disorder. Narcissistic personality disorder is defined by grandiosity, a lack of empathy, and a constant need for admiration. In relationships, narcissists often use bullying tactics to maintain power. They are hyper-attuned to others' reactions, not for empathy, but to extract attention and validation. Their abuse is premeditated and strategic, with patterns of infidelity, dissatisfaction, and exploitation. They are often repulsed by genuine intimacy, yet simultaneously demand loyalty and admiration from others. From a dimensional lens, narcissists vary in how fragile or aggressive they may appear, but the enduring lack of empathy and their grandiosity remain defining traits, regardless of outward emotional expression. Next, we have borderline personality disorder. Speaking about borderline personality disorder professionally, but in a public setting, typically results in some harsh criticism and feedback toward the person providing the information. So again, I just want to be clear. When I use these terms, I'm not using the term borderline personality disorder as a pejorative or an insult. I'm simply sharing research that has been conducted and verified related to the disorder. Borderline personality disorder is characterized by unstable relationships, emotional dysregulation, and behavioral dysregulation. In relationships, this can often look like violence towards self, but also others, hypersensitivity to perceived rejection, and often tactics like emotional blackmail in an attempt to avoid perceived abandonment. Suicidal gestures, self-harm, and explosive anger are commonplace. In some, sexual behavior is often impulsive, reckless, and retaliatory. Partners may temporarily be abandoned when the borderline individual feels insecure in the relationship. Retaliation can be both reactive and intentional, using threats in an attempt to control closeness. Borderline personality disorder is highly heterogeneous. One person with BPD may present as chaotic and externalizing, another as quiet and internalizing, yet both meet the categorical criteria. The dimensional model adds clarity by capturing the severity of traits, including impulsivity, hostility, and emotional lability. Histrionic personality disorder is marked by excessive attention-seeking and excessive yet shallow emotionality. Relationally, this manifests as pathological flirtation, dramatization, and endless demands for attention. While they solicit for compliments, there's never going to be enough compliments for them to satisfy. They may abandon relational commitments if someone new offers excitement or novelty. Relationships are shallow, dramatic, and unstable. Partners often feel like an audience rather than an equal. From a dimensional perspective, histrionic personality disorder reflects enduring attention-seeking and emotionality. These are not occasional behaviors. They are consistent strategies across time. Across antisocial, narcissistic, borderline, and histrionic personality disorders, a major theme stands out: exploitation over intimacy. These patterns are not fleeting symptoms or traumatic reenactments of a painful past. They are enduring, consistent strategies of relating. Again, I want to clarify, these are not my personal ideas, personal opinions, or even my preferences. They come from decades of research and diagnostic manuals. I also want to clarify that there is a lot more to these disorders than I just discussed. This is more of a summary or an outline. If you found this helpful, please check out some of my other videos on the channel. Also, take a look at my book, The Nature and Nurture of Narcissism, and my book, Traumatic Cognitive Dissonance. I'm also featured as a personality disorder expert in the Hulu series Ted Bundy, Dialogue with the Devil, streaming now on Hulu and Disney+. Until next time, I'm Dr. Peter Salerno, and thank you for watching.